Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 122, Bearing the Cost of Irresponsible Healthcare Decisions. In an interview on Wednesday, April 9th, Health and Human Service Secretary Robert F. Kennedy Jr. asked whether society should pay for the health care of Americans who eat donuts or smoke when they know those habits can lead to poor health outcomes. Kennedy asked, if you're smoking 3 packs of cigarettes a day, should you expect society to pay when you get sick? The general questions that Kennedy asks are, should society limit healthcare based on personal behavior? And should society make a person pay more for healthcare based on personal behavior? Now, let's look at the logical extension of that second question. Should society make a person pay more for healthcare based on personal behavior? One logical extension of that question is, should society make a person pay for other people's health care when they encourage behavior that causes people to need more health care? Kennedy, who is a noted vaccine skeptic, has likely caused more cases of measles and whooping cough by encouraging people to avoid vaccines. At the time of this podcast episode, 2 infants in Louisiana have died of whooping cough, and there have been 2 confirmed deaths from measles. There has been 712 confirmed cases of measles, and most of the cases are in communities that have low vaccination rates. Should Kennedy and other vaccine skeptics be made to pay some of the increased medical costs because their anti-vaccination position caused more people to get sick? Should Donald Trump and his allies have been forced to pay some healthcare costs because during COVID, they discouraged people from getting vaccinated and pushed treatments that did not work, such as ivermectin? Of course, it's not just individuals who can cause higher healthcare costs. Health insurance companies increase healthcare costs when they deny care. Should they be made to pay for their refusals that prevent people from getting health care? The answer to that last question is an emphatic yes. Right now, health insurance companies suffer almost no consequences when they deny care. Society needs to start making insurance companies pay hefty fines when they deny care. Additionally, there's another group of people in companies who cause higher healthcare costs. It's the people and companies that refuse to support single-payer Medicare for all. That raises the cost of healthcare in the United States anywhere from $400 billion to $1 trillion every year. Now, who pays for those extra healthcare costs? You, I, and everyone else pays for those extra costs. What infuriates me is that there are people and organizations who fight against Medicare for all so that they can make profits from people being sick and needing health care. This obstinate behavior not only causes us to pay enormously more for health care in this country, it also causes more than 76,000 preventable deaths every year. While it would give me some comfort to make people and organizations pay for the damage and higher healthcare costs they cause, it would be much better to eliminate the problem with Medicare for all. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.